Thank you, Shirley, and thank you to all for this invitation to speak in Paris about the role of dairy in nutritional security. I'm delighted to be here. I'm from Dublin, Ireland, and the dairy industry is really important to Ireland, both for nutritional security and for economic security. My disclosures, in large part, I'm an academic, but I have had in the past some commercial connections. Nutritional security is more than food security. It builds on food security. Food security does mandate consistent access, availability, and affordability of foods and beverages that promote well-being and prevent disease. Nutritional security does more. It says that we have to provide that for all communities of the world. So all ethnic minority populations, low-income populations, as well as medium and high-income, and rural and remote populations also. I think it's helpful to look at what is a definition of a healthy diet. And a healthy diet has to do two things. It has to protect against malnutrition in all its forms, as well as non-communicable diseases. They're the chronic diseases of middle and older ages. So conditions such as diabetes, heart attacks, strokes, and cancers. And they're in large part diseases of excess. And we're not doing very well. At least a quarter of the world is now overweight or obese. And that's not just in high-income countries. It is impacting in Asia and in Africa also. It's shame on us that almost 1 billion are chronically undernourished. These people go to bed hungry some of the days of the year. They do not get enough calories. What's less well recognized is the last panel here, that at least a quarter of the world suffers from hidden hunger. In fact, it's probably more, as I'll show on the next slide. And this is where people have enough calories, but the quality of their diet is insufficient for optimal health. In particular, they lack high quality protein, essential fats such as omega-3 fats, essential vitamins and minerals. And looking at this slide here, a recent analysis has shown that in fact half of the population doesn't consume enough iodine, enough vitamin E, calcium, iron, riboflavin, which is a B vitamin, folate, and vitamin C. And then there are high percentages that lack other critical vitamins and minerals. So at least half of the world's population actually are suffering from hidden hunger and do not have optimal health. Interestingly, milk and dairy products are rich in many of those lacking macro and micronutrients. So a glass of milk, 250 mLs, actually provides 15% of protein requirements. And all of those red vitamins and minerals, at least 10% of the daily requirements are provided by one glass of milk. It's not just about levels of intake. Let's look at a real endpoint. Let's look at childhood stunting. And you can see from the top right-hand panel, the areas of the world where childhood stunting is very common: Sub-Saharan Africa and Southern Asia. more than 1 in 3 children suffer from childhood stunting. That's not just small children, that's children who are physically maldeveloped, whose brains are not as well formed as they should be. These children do not perform or achieve very well in school, lesser career options, lesser ability to provide for their families in future generations. So you get a vicious circle. They're the exact same areas where milk consumption, seafood consumption, and meat consumption is least. That's an association study, and there are other factors. Absolutely, poor hygiene, poor education contribute to childhood stunting, as well as poor nutrition and interact with poor nutrition or inadequate food. But let's look at a randomized controlled trial. It's basically the only one that's been conducted. It was conducted in Kenya about 10 years ago. And what they did was, I'm just going to see if the pointer works. It does, actually. They looked at 12 schools in Kenya, primary schools, so children aged 8 to 12. And they randomized the 12 schools to 4 different feeding groups. So 3 schools got an additional vegetable stew every time the children turned up for school for 2 years. This group got the vegetable stew plus dairy, plus milk. This group got the vegetable stew with additional meat. And the last group, the control group, got no additional food. The 3 groups that got additional food, they actually got the same calorific, additional calories per day, but there was a very different pattern in the amount of protein and the micronutrients that were provided to the three groups. At the end of the 2 years, or 5 semesters in fact, they looked at the children's performance in 7 different subjects. So arithmetic, English, 2 national languages, which I'm not going to try and pronounce, geography, science, and the arts. And they looked at their overall score. So this right hand, these columns summate the scores of the children across the 7 subjects. The groups the schools and children that got additional meat and vegetables, 17% on average greater scoring. The dairy group, plus 13%. Both of those groups were considerably better than those children that just got the vegetable stew or got no feeding whatsoever. 17% and 13% is huge. So imagine if these groups, if the control group had on average 50% in their scores across all the children. The average score of the milk group was 63% and 67%. That's a huge difference in average scores. I can certainly tell you which school I prefer my children to be going to. And I wonder what would have happened if we actually gave additional meat and additional dairy. That experiment has not been done. It's not just the young that benefit from additional animal source foods. So the more animal protein that was eaten in this study, the longer the adults lived. And that may be because meat and dairy actually protect against chronic disease. So let's look at the impact of dairy on cancers and cardiovascular events. It's very well established that the more dairy you drink, the reduced the level of colorectal cancer. More recently, it's been recognized that greater dairy actually protects against obesity. with knock-on impacts for diabetes mellitus. This study from the PURE study, the prospective urban-rural epidemiology study, which is a study which was conducted across all 5 continents in low-income countries, medium-income countries, and high-income countries. And what they looked at was they compared those who were eating less than a half a serving of dairy per day with at least or more than 2 servings per day. 25% reduced total mortality. 30% reduced heart attacks and strokes in those who were drinking at least 2 servings of dairy a day. And what was really interesting was that this pattern was much stronger for full-fat dairy than for skimmed milk or reduced fat. So we don't know what it is in dairy or milk that is providing protection against cancers, heart attacks, and strokes. It could be the protein, it could be the calcium, it could be the fat. And it doesn't, this next study doesn't prove it, but it certainly causes us to question whether we should be taking fat out of dairy. This Scandinavian study looked at a biomarker of dairy fat. You really only get pentadecanoic acid in dairy. And they looked at the levels of this pentadecanoic acid in the serum of participants in the study. And then they followed them up for mortality and cardiovascular disease events, that's heart attacks and strokes. And you can see the higher the level of the pentadecanoic acid, the lesser the number of heart attacks, strokes, and deaths. There's actually a 40% reduction really across the effective range of this biomarker of dairy intake. But we absolutely have to recognize that we have climate and biodiversity crises, and they pose catastrophic threats to human health. So we can't go on feeding the world without looking at how we're producing food, because the food system does definitely contribute to both climate and biodiversity crises. And it certainly can be argued that the animal source foods contribute more than plant source foods. So definitely one of the proposed solutions is that we go over more to plant-based diets. And probably the most famous of these is the Eat Lancet Planetary Health Diet, which was first published and talked about in 2019. The Eat Lancet Planetary Health Diet, by comparison with the UK Eat Well Guide, requires a doubling of intake of fruits, vegetables, legumes, nuts and seeds, and a halving of animal source foods. So you can see that dairy goes from this section of the plate to this halving of dairy intake. An even greater reduction of meat, and particularly red meat, probably an 80% reduction in red meat. And the Eat Lancet Commission were absolutely confident that this would benefit planetary health and that it would provide nutrient adequacy and that it would prevent these chronic disease events. So we'll just have a look at that. The problem is that the Eat Lancet Planetary Health Diet only contains 13% of calories coming from animal source foods. And we've known from other cross-population studies that the lower the amount of calories that come from animal source foods, the more in danger are our populations with vitamin deficiencies. So you can see once you go below 30%, increasing vitamin deficiencies, and similarly for key minerals, once you go below 30% of calories, more deficiencies. And that's because, in fact, animal source foods are the richest source of many of these commonly lacking micronutrients. Of the top 20 foods here that are rich in these micronutrients, 18 are animal source foods, including various dairy products. So it's great that actually that some of the authors of the Eat Lancet report actually have recognised that there was a problem with the Eat Lancet diet. And Jessica Fanzo worked with other colleagues, including Tig Beale, looked at the Eat Lancet diet, said actually we would have vitamin B12, calcium, iron, and zinc worsening of these deficiencies if whole populations ate the Eat Lancet Planetary Health diet. Insufficient attention had been paid to the actual realistic daily requirements, and insufficient attention had been paid to the anti-nutrients that are present in plant foods and the better bioavailability of zinc and iron from animal source foods. So in fact, they recalculated a diet that would be nutritionally adequate, and they came up with that actually animal source foods would be increased to 27%. Now, this is one possibility. Dairy foods actually increased from 6% to 7%. There was a massive increase in fish from 2% to 7%. I'm not sure if that's realistic, and I think there's lots of different variations. And in actual fact, an increase in dairy might allow for a more realistic increase in fish products. But I think there's a lot of variation that would achieve micronutrient adequacy, and some will be more suitable for various communities. So it certainly is encouraging that we are hearing that Eat Lancet Mark II will be more flexible and more recognising of the need for micronutrient adequacy. And in actual fact, the problem with environmentally protective plant-based diets was recognised in this systematic review of the 56 studies that actually looked at micronutrient adequacy with plant-based diets. This was published last year and was led by an Irish professor, Professor Mairead Kiley. Let's look at chronic disease. Again, Eat Lancet said that their diet would protect against heart attacks, strokes, and cancers. But when the Pure collaborators actually looked at that, they found that there was no difference between in number of heart attacks and strokes that occurred in people who were not at all adherent to the Eat Lancet diet to those who were, by comparison with those who got the top score of 13 of the Eat Lancet diet. By contrast, they developed their own Pure diet score, which focused on eating lots of 6 healthy foods: fruit, vegetables, legumes, nuts, fish, and dairy. And they found that actually adherence to their Pure diet score did protect against mortality and cardiovascular events. It's not only the Eat Lancet that has promoted reductions in animal source foods. There are multiple other publications. This one here said, stop eating your burgers because you lose 35 minutes of life every time. This audience can't continue to laugh because dairy have been hit too. You get an extra year if you reduce your dairy intake from 3 glasses of milk to under 1. I'm going to focus for a couple of slides on one publication, the Global Burden of Disease Risk Factors Study. And the reason is because many of the other publications use the metrics that are derived from the global burden of disease or their analytical approach. And in fact, the WHO, the UN, FAO, the EU all use data from the global burden of disease collaborators. So they're very influential. In this chart, I'm showing you dietary risk and deaths from the 2017 and the 2019 analysis. 2017 in blue and 2019 in red. The excesses are shown on the top, and the big excesses are excessive calories or diets high in sodium, and deficiencies towards the bottom. Big deficiencies are child and maternal malnutrition, which actually does hide diets that are lacking in animal source foods and other nutrient-rich foods. Global burden of disease collaborators did recognise that diets low in milk were causing deaths, but it's a gross underestimate. They only acknowledged that dairy protected against colon cancer. They did not recognise diabetes mellitus, obesity, heart attacks, strokes. We were very concerned about this massive increase in deaths attributed to diets high in unprocessed red meat. Went from 25,000 to almost 900,000 per year globally. So a 35-fold increase in deaths attributed to red meat, with no evidence presented for that change. Previously, they had used published systematic reviews and meta-analysis. They did their own systematic reviews and meta-analysis, did not publish them for all dietary risk factors. So we wrote to the Lancet, and our letter was accepted after 6 months delay. And we asked 2 questions. Where's the evidence? What would happen to deficiency illnesses and deaths if red meat consumption was reduced to 0? We were delighted when we were joined by one of the founders of evidence-based medicine, Professor Gordon Guyatt from McMaster, and also from researchers from the Academy of Nutrition Sciences and the World Cancer Research Fund. We did get a response eventually, and they said, we may have got some of our analysis wrong, we'll do better next time. No offer of immediate correction, which is the absolute standard. And they said, we actually don't count deficiency deaths for red meat. Interesting. They did publish a systematic review of the relationship between red meat, colorectal cancer, breast cancer, heart attacks, diabetes, and 2 types of strokes. Very different conclusions now once they published the systematic review for red meat. No or very weak evidence that unprocessed red meat is associated with any increased risk. They have published systematic reviews for vegetables, but there's 19 other dietary risk factors which have not been published, have not been peer-reviewed, which calls into question the Global Burden of Disease 2021 analysis, which have just been published. And there are multiple errors in that. It is good that the UN and some UN and WHO reports have recognized the nutrient richness of animal source foods and the positive impacts of dairy on non-communicable chronic diseases. However, there are multiple publications, policy documents, and dietary guidelines that are influenced by Eat Lancet Mark 1 and by recent global burden of disease risk factor reports. I'm particularly, from the dairy point of view, I am particularly concerned about these two. This is the World Health Organization European region tool for calculating or analysing environmental and affordability dietary guidelines. The Lancet Countdown report is published every 2 years. Both of these documents rely on an analysis from Professor Marco Sprigman's group in Oxford. And for dairy, the way it goes, it says, Eat Lancet said you could only eat 250 mLs, second last slide, Shirley. You can only eat 250 mLs of dairy per day. So these documents say if you are drinking or eating more dairy than that, that is excessive calories. It is causing obesity. And dairy is causing 600,000 deaths per year through obesity, heart attacks, and strokes. That totally goes against the evidence that dairy protects against those conditions. These are my key take-home messages, and I'll stop there. Thank you.